a distinguished panel. Go for it.
Thank you, Mr. Chair. I'm Alyssa Keny-Guyer, represent House District 46, parts of Southeast Northeast Portland, and one of my primary focuses in the legislature has, as you know, been maternal and child health. So I was very honored that my own constituent, Marguerite Cohen, Dr. Marguerite Cohen, who's sitting behind us and you will hear from, brought this bill to me on behalf of ACOG, the American College of OBGYN. She is I believe, the Western Regional Representative for that. And soon after she brought that to me, and I started really paying attention to this issue that they have been paying attention to longer than we have, the news started really breaking over the last few months about the rate of maternal mortality in the United States going up and being so much higher than other industrialized countries. And in addition to that, we also know now from the statistics that the disparities between white women and women of color are very great, particularly in the African American community, where the rates of maternal mortality are often 3 to 4 times higher. So many states, as a result of this, have, and with a lot of encouragement from the CDC and ACOG, have been starting to set up these maternal mortality review committees. And my interest in this is of course, maternal and child health and closing racial equities, and also wanting to make sure that we look not just at the clinical side of it, what happens in the birthing process, but also prevention and oral care, access to health care services like oral care, where we know that when 50% of the women who deliver here are on Medicaid and 50% of them have periodontal disease, and we know, Representative Hayden, the impact of periodontal disease and continual bacterial infection on inflammatory factors for the woman and for the fetus, and that results in bad birth outcomes. So there are many things where this really brings together so many of my interests to look at that. In addition to access to health care, of course, there's all the prevention, social determinants of health, what happens when women, pregnant women lose their housing, have that kind of toxic stress, or have mold in their homes due to turning down the heat because they can't afford the rent. So lots of different factors there that I think this committee will have the opportunity to dig into and see if we can both reverse the rates for all women and close the disparities. So I'm delighted that we've had so many stakeholders be a part of this. We are going to look beyond mortality and look at morbidity issues. Once the committee gets established looking at mortality rates, they will then go on to severe morbidity, because we know that for every mortality, for every death, there's 50 to 100 severe morbidity cases where women almost died or have very severe short or long-term consequences. The -1 fixed some of the membership that we had from the stakeholder group after the first bill came out. It forgot medical examiners, so the -1, in the -1 we forgot the medical examiner, but we will be adding that in the -2. -1 is basically a gut and stuff. We wanted to make sure that we added things that needed to be examined under social determinants of health, like race. The -2 will have other things we want to consider, like domestic violence and housing. We want to make sure also that we include access not only to preventive care and primary care, but also oral and behavioral health care. So the -2 is probably going to be out today. We are also working on a -3 that will really make sure that we clarify the legal language. We want to make sure that families continue to have access through the courts, as they always have. While this new review committee is being set up, that is a totally separate committee. We want a firewall. I'm sure that others will mention this, but we're working really hard to make sure that the language is right. I'm happy to answer any questions from the dais later, and at this point I want to turn it over to my colleagues. I'm very delighted to have them join me in co-chief sponsoring this.